I understand that we were both trying to put some information into this conversation so that people understand all the connection. But I know that it's also difficult to explain everything and how it all those pieces fit together. I just remember I went to Latvia, which is the country I'm from originally, together with my partner. He
Yes.
came with me for the first time this February, and we got sick and we had a flu. It was really bad. And my mother uh, got in contact with her doctor, and her doctor said, okay, I would prescribe her
Yes.
some flu medicine and go to the pharmacy. And I went to the pharmacy, talked to the pharmacist, and she also said, take this tea. And
Yes.
there's that herbal tea and suggested
Yes.
stuff. And my partner was so surprised. He said, in America,
Yeah.
you would never see a pharmacist to recommend tea. And that tea
Right.
was all the herbs and all together.
Yes.
And Latvia still has that, ancient medicine
Yes.
and that wisdom, and pharmacists know that.
Yeah, well, a lot of the most of the pharmaceutical agents, they come from plants.
Yeah.
They're just chemically modified. But definitely, that probably made you feel so much better
Oh, yeah.
because plants are medicine. That's where pharmaceutical agents come from. So I wish we could practice more like that here without it being looked at as, something that's not typical, because it should be a first line.
Yeah.
Um, one of the other companies that I have that I'm a part owner in and medical director of is a mobile IV company where we do IV vitamins and fluids. And so we have a number of nurses that work with us. And so we will go to a patient's home, to their hotel, to wherever they are if they call and they want an IV. And we have different combinations of vitamins that we give them that they can choose from. But one of our most frequent calls, of course, is if someone has a flu or a cold and you don't want to go to the urgent care or to the ER and you want to get IV fluids and you want to get some vitamin C and some magnesium and some B complex vitamins. And then the patient feels so much better the next day. I mean, I hear it all the time. And then we have a lot of patients that do that for preventative health. So just because they're monitoring their nutrient levels, which is something that can be done with simple blood work, and they want to keep those at optimal levels for optimal health, for peak health. So that is similar to what you're saying about the herbal tea. And so IV vitamin therapy is something that I work with as well.